Hi, this is Dr. Carrie Kramer-Webb with Resurgent Sports Rehab, and today I'm here to talk about hip labral tears. So this is a very common injury in runners, and I want to clarify what exactly the hip labrum is, why it tears, and what you should and should not do about it. So, quick anatomy lesson. Here we go. Picture this. This is the pelvis here, and then we have the thigh bone or the femur. This is a ball and socket joint. So the labrum is cartilage that lines the rim. So if I take this, and it's all along the perimeter, what that does is it increases the shock absorption in that joint, and it allows for certain ranges of motion of the femur. So it's a really, really important structure. What can happen is when you have a lot of instability in your leg as a runner, you can get a lot of sloppy movement through the hip. And by that I mean, when you land on the hip, you could get a hip to drop, and that can increase some pressure and strain on the labrum to the point that it could actually tear. Now, if there's a huge takeaway from today, that is just because there's a tear there does not mean you need to get surgery. You need to stabilize this area and you can be totally fine. Consider that if the hip labral tears are related to the sloppy hip movement, we want to make sure that you are able to check that on yourself at home. The way that you can do that is self-test. All you need is a mirror, and you are going to do a single leg hop. On the third one, you're going to stick the landing for 3 seconds. What you're looking for is for the trunk to be upright, the hips to be level, the knee to be pointed straight towards the mirror, and the knee to be in line with the second toe. If you've got all those things in good alignment, you know that you will be ready to go with good hip stability. In order to fix your single leg instability, you're going to work on some strengthening exercises. Put a band above your knee, and then you're going to tap down, side, diagonal, and back, really working on the stability of the stance leg to keep the hips level, the knee pointed straight ahead, and the arch maintained. Once you're good at that, you take the band off, and you can work into dynamic single leg squats, coming up and out of that position each time, side, diagonal back, and back.